Hey guys, it's Jenn Parker from Embody Wellness Physical Therapy, and today we're going to be just going over Pelvic Floor 101. And basically that's going to just be looking at the anatomy and finding out where it is, and then also what are the main functions of pelvic floor. So this is a female pelvic model. Basically, we can kind of figure out where we're oriented by this is looking at the side of the pelvis. This would be like the lumbar spine and coming up and down. We have this bone right here. This is called the ilium, and this is the iliac crest. This bone here sticks out in the front. It's called the ASIS for short. So just to kind of orient where the pelvis is, it's going to be right about in that general area. And then as we keep going along that ilium to the back side of the pelvis, we have the sacrum here and the last two lumbar vertebra, L4 and L5. We have these two joints right here on the side between the sacrum and the ilium. This is called the sacroiliac joint or the SI joint, and we have two of those guys. It's innately a really stable joint. At the bottom of the sacrum here, we have the coccyx or the tailbone right through here. Kind of going along back to the front side of the pelvic floor, the pelvis, we have the pubic bone. And right in between the pubic bone, which is here, we have what's called this cartilaginous joint. Woo! And this is called the pubic symphysis here. So during pregnancy, this does start to separate a little bit and become innately a little bit feeling, sometimes we can get pain here because of some of that changing in the pelvis. Basically, it's doing that and this to make room for the baby's head. And then last of the bony structures here, we have the acetabulum. So this is the ball and socket joint of the hip. The femur or the leg bone would be the ball, and we would walk like that. And then we have the ischial tuberosity here. So that's kind of the sit bone or the butt bone. Generally, we should be sitting on that bone. We have hamstring muscles that come up and attach to the sit bone, as well as some of our inner thigh or adductor muscles. And we also have some of those inner thigh muscles attaching onto the pubic bone here too. So all these different bony structures help to make up the bony pelvis. I think of the pelvis like a bowl or a bucket, and that's the side walls, forward and back. The bottom of the bowl or the pelvis is the pelvic floor. So the pelvic floor is all of these red muscles, all of them. There's a lot of them. And there's different layers, and this model can show that we have these more like superficial muscles and then even some of these deeper muscles here. So we're going to flip this upside down just to orient ourselves here. From the tailbone in the back here, we have the external anal sphincter. We have the perineum area through here. We have the vaginal opening, and then we have the uterine opening, and then we have the clitoris up here. We have these muscles that help to kind of close, stop a bowel movement, stop gas, stop some urine. So we have more of these superficial pelvic floor muscles that are helpful for closing. And then we have these deeper pelvic floor muscles all together called the levator ani. So there's lots of different muscles in there, probably 5, 6, or 7. I don't even know the exact number. And then also this model shows, and we have this hip rotator muscle inside of here called the obturator internus, and it really takes up the whole side wall of the pelvic floor here. Obturator internus is a hip external rotator similar to the piriformis. So that is a little bit of the different muscles that are inside of the pelvic floor. We have some basically that wrap around the vaginal opening. Again, we have a female model here. We have muscles that wrap around just the uterine opening to stop urine. And then we have muscles that even wrap around the rectum here and then come back forward and attach to our pubic bone. And then we have, again, some deeper muscles back inside the backside of the pelvic floor, which attach to our tailbone and sacrum there. So that's a little bit of the pelvic floor anatomy. This model doesn't show, but we have a lot of nerves that run here through this area too. So nerves that come out through the spine, kind of dip in through the pelvis, coming back around the pelvis, and then come to the opening here. So that's called the pudendal nerve, is the main nerve that comes down into the pelvic floor here and helps with function. So some of the things that the pelvic floor does, some of its functions, it has basically 5 main functions. So the first one we have is it helps with sphincteric control. So help, again, stops leakage. That's one of the big things is I hear is that someone jumps or coughs and these muscles are not working efficiently and they're getting leaking. So that's one of the functions. Another function of the pelvic floor is it helps with supporting the pelvis. So again, it's the bottom of the pelvis, so it works together with some of our hip muscles, our core muscles, our diaphragm, to help stabilize the pelvis. We also have some supportive functions. So I do not have the organs inside of this model here, but we have the vagina, we have the uterus, we have the rectum, and then we have the bladder that sit inside of the pelvis here. So the pelvic floor, it's one of its major goals is to help support and keep those organs elevated inside of the pelvis. So especially these deep lifters, their main job is to work with the deep core system to help keep those organs in their space. Sometimes women can have a prolapse after they've had children, or even years later with chronic constipation or just kind of poor management of pressures in their system. So these muscles can be even overworked and start to become inefficient. We also have the pelvic floor works as a sump pump. So it helps with getting fluid moving from the lower extremities up through the system, back up to be redistributed through the body. So sometimes during pregnancy, we see this a lot where there's just a lot more pressure going on through here. So we have some swelling, and that can occur, varicose veins that occur in this area just because it's getting overworked. Or potentially just the way that the pelvis is or the baby is, it's just putting pressure on the ability for that sump pump to work efficiently. And then there are also sexual functions. So these muscles have to open and kind of accommodate for any sort of initial penetration to occur. They also need to have an orgasm. It's essentially a big contraction of our pelvic floor muscles followed by a relaxation of these muscles. So we might often hear that my orgasm is weakened, or if that sometimes can occur if these muscles have become a little bit weaker, or we also may have a hard time even having an orgasm because these muscles are a little bit too on. So just depends on the person. And then we also have these muscles work with our breath and our diaphragm to help with movement of the pelvic floor as well. So every time I'm breathing, my pelvic floor is just gently moving up and down. So from learning about some of the functions of the pelvic floor, we want to make sure that the pelvic floor is working efficiently for all of those jobs. So just doing something like a Kegel contraction doesn't necessarily help with understanding how that works for the whole system. And really getting that pelvic floor assessment can help figure out, is it appropriate for Kegels? Do I know how to move those muscles correctly? Am I standing in the right position for myself? Am I breathing very efficiently to where I'm getting this natural movement of the pelvic floor? So those are all just things to kind of keep in mind. And that's something that a pelvic floor physical therapist can help you figure out. So I hope that you learned something new today in Pelvic Floor 101. And let me know if you have any questions.